Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, hello everyone. I am Dr. Pramod chaurasiya, neurosurgeon and director Paras Neurospine Hospital, Lucknow. And today I would like to share some insight about epilepsy, which is a very prevalent neurological disorder worldwide. So there is definition-wise a difference between seizures and epilepsy. Seizures is the first ever episode. It is called seizure, but when it keeps on repeating, then it becomes epilepsy. And we need to understand the global burden of this disease. Epilepsy, it is a very prevalent neurological disorder worldwide, and around 50 million people are suffering from this disease. And out of those 50 million, 75% of those patients are from lower and middle income group countries, and out of those 75% patients, 80% of the patients are not able to take adequate anti-seizure medications. So we need to understand the burden of the disease and its treatment options.
What are the different types of seizures? And do they affect people differently?
Yeah, seizures are mainly of two types. One is partial or focal onset seizures, other is generalized seizures. In partial onset seizures, most of the times patient remain in its maintains its sensorium, and it is presented as a focal seizures like limb movements, facial twitching, blinking, and some sensory symptoms. And usually it starts from one part of the brain and it remains limited. Sometimes it becomes generalized. While the generalized seizures are the seizures which involve both halves of the brain, and mostly the patient loses the consciousness and there are abnormal jerky bodily and limb movements. So these are basic two types of seizures.
A known cause?
No, around 50% of the cases there is no known cause of the seizures, but in around 50% of the cases there are certain pathologies, disease conditions, metabolic disorders, genetic disorders which cause seizures. So the cause of seizures varies with the age also. No any age is immune, but the causes for seizures in different age groups are different. Like in childhood, it is mostly due to perinatal hypoxic disorders. Brain suffers due to lack of oxygen, and that causes seizures. One is other is febrile seizures due to temperature. Sensitive areas of the brain get affected, and that causes seizures. Some infections like meningitis, encephalitis, they also cause seizures. While in adulthood, mostly some infective pathologies and trauma is one of the most common causes of seizures. And older age group, brain tumors, severe like brain attacks, those are main reasons for seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
The most important sign and symptoms of epilepsy that the patient can present as slightest transient loss of consciousness, involuntary bodily movements which cannot be controlled by the patient himself or herself. There are blinking of eyes, facial twitching, abnormal sensations, abnormal vision, abnormal hearing. There is paucity of speech, weakness in one limb or other. These are the symptoms of seizures.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, it's a very common notion that it is something of your bad deeds, and you are being punished by God. That's why you are having this type of disease, which is deadly and incurable. These are the myths, and which should not be given much importance, because in modern days it is well known and well studied disease, and it is most of the times treatable, and it can be controlled by medications. So it has nothing to do with those religious beliefs and social stigmas. The patient, relatives, neighbors should always consult a specialist for anybody who is suffering from this disease, and it can be controlled, it can be managed, and patient can lead a normal life.
How does this stigma affect people with epilepsy?
Most important is that people don't try to consult any doctor, or don't try to share with their relatives and friends, because they think that they will think it's a kind of my bad deeds, and it's something related to my birth and past births. So this hampers the treatment, and the patient sometimes end up with loss of life, which can be treated by a consultant, which can be treated by an expert. But due to their ignorance and these stigmas, uh, they suffer a lot, and they mm, don't survive.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
There are many things which trigger the seizure onset. The most important things that we see in practice is like bright flashes of lights. They are a strong trigger factor. Fasting, if they are not taking adequate meals at adequate intervals, then it can seizure can mm, uh, be there. And mm, alcohol, excess alcohol, some medications without doctor supervision, and some nutritional or dietary habits like hyperkalemia is supposed to cause seizures, hyponatremia, even hypernatremia, hypoglycemia, low blood sugars, high blood sugars, infections, they all can cause seizures. So we need to understand what precautions are to be taken, and which medication should be taken, or and which should not be taken uh, and by the patients of epilepsy. So it should always be under a doctor's or expert's supervision.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
There are some theories which support keto diets, that is rich in fat. Around 90% of the dietary supplement is by fat, and 10% is by protein and carbohydrates only. So it does help in seizure prevention and the chances of recurrence. And hypokalemia is supposed to throw seizures, trigger seizures. So hypokalemia is one of the factors that can help to some extent. And adequate sleep, stress-free life, um, mm, exercises, some meditations, yoga, and these are the things which can keep you healthy and seizure-free.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah. The most important thing, whenever you see a patient suffering from seizures, first of all, uh, make space around him, so he or she can breathe easily. There should be no crowd. And the second thing, you need to see whether it's the airway, that is neck is tight, something tight collar or tie. Then always try to release it. If there is some denture, then remove it immediately, because it can obstruct the airway. And make the patient lie in lateral position, so that chances of aspiration are less, and always call the ambulance for help. These are the basic things which you should do if you see a patient.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
The only thing that we should always consult the expert, and 70% of the seizure disorders can be managed, can be treated, can be controlled by medications only and some lifestyle modification. So a person with seizure disorder can lead a healthy and normal life, healthy life of years together. There is no chance that the patient die of seizures only if he is well controlled, well managed with medications. Medications are nowadays very good to control the seizures, and they are cheap also, so cost is not an issue. So always consult your doctor and remain seizure free with the medications.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.